component, which includes family planning, birth control, STD, is going to be minimalized. That program is going to be cut. The women's health strategy is going to be eliminated, and minority health advisory committee is going to be eliminated.
Yes, that bothers me because what affects me affects everybody, and what they're trying to do is like taking the finger out of the dike so it just floods, and people don't understand what effect it has on you. The other night we were just talking about birth control. It's important that people understand that. To me, Viagra is one of the components of it, and then you're going to take our stuff away and give our male component something else that's going to trigger his mind and his body.
Well,
So,
so,
what does
so
that
what,
mean?
so what we're gonna say is we're gonna keep the gun shooting, but not have any protection against the bullets. Was that, can we say that?
That's a good way of saying it.
Yes.
I mean, really, yes, people take issue with this because there's always your side and my side, and there's nothing in between, like you have a middle ground just about anything that you do. But now it just seems like everybody is trying to diminish our rights as women.
That's it.
And I'm so glad that we're going to talk more about this upcoming event. But with being an activist and Obamacare is coming down the pike, there's so many things. What kinds of feelings or feedback are we getting from John Q. Public and Susie Q. Public?
I think now that women, especially across the boards, are starting to recognize that some of the legislators are trying to divide us by saying it's an abortion issue.
Yes.
They're starting to put that aside and say, wait a minute, let's unite on what it really is. It's taking away our ability, and it's not to give us free birth control. They would take away our ability to even purchase birth control after we've paid a premium. They would take away our ability to have in a plan that we pay premiums on mammograms.
Right.
So we will be paying the premium. This is not asking for free stuff.
Mm-hmm.
So we're trying to unite, and that's what Sharon's working on with us, is to unite around those general healthcare issues that are not just women's issues. If you got a girlfriend, you got a women's issue. If you got a mama, you got a women's issue.
Mm-hmm.
So if you're a man, Viagra or not, you better be concerned about the women in your life.
Hmm.
But Sharon will tell you how we're going to make all these people come together.
That's going to be the big job, Sharon. And sometimes, even as like older people, older women have ways of saying, well, it's not my ideal. It doesn't affect me anymore, but it's the daughters, the friends who it
Exactly.
affects. So,
It's our daughters, our grandchildren, and I would like the audience to be aware of unitewomen.org. And what we have is a national movement that we are going to come together on April 28th in every capital city in all 50 states will be rallying. And we are rallying around the war on women. And I don't really consider it a war on women. I think that it is a war on families. Because the stuff that is happening to us is going to affect preventative care for us, which brings us back to mammograms. It is also going to affect our children. Here in Florida, they're considering not funding or underfunding clinics. So it's going to affect immunizations for children. And I just want people to be engaged and pay attention to what's happening because there are a lot of issues going on there. Another issue that we have is that we are passing legislation throughout this country that is affecting our right to vote. And we don't want to get sidetracked. We want to pay equal attention to the war on women, and we want to make sure that we are not losing our right to vote. And the rally is going to be on the steps of the old Capitol, April 28th, from 12 until 2. And we will have people there, our supervisor of elections, Ion Sancho, and he's going to be giving us information on how legislation that has passed is going to affect your ability to vote. They have narrowed the window for early voting.
Yes.
They have purged the records for mailing you your ballot. Everybody has to start over. If you voted by mail, you have to call and do that again.
And get your name back on
And
the
get your
roll.
name back on the roll. There are a lot of issues that are really impacting us, and I really want people to pay attention.
I think people are. The thing is, they don't know what the end results are going to be, and it
Mhm.
seems like, they call me an atypical politician, but I think I'm atypical grandmother, mom, that kind of thing.
Right.
It bothers me when somebody tries to change my perspectives, what I want, and I don't want anybody in there voting for me or keeping me out of the chain of command to use that ballot.
Right,
See, I was one that fought for us to have
right,
those equal rights, and you're
I
gonna
know.
try to take them away?
right.
The big fight. I'm ready for this war on women now.
And I think that,
People are gonna come out and deal with it.
and I think that's the thing that this rally that Sharon's talking about on the 28th on the steps of the old Capitol is so important, because there are so many issues that we can be united on, and there are so many distractions, as Sharon so well said, trying to pull us away. And when you look at healthcare, when you look at President Obamacare's legislation, you see that he recognized public health, and he recognized family planning in his public health program, and he said, wow, since the 1960s, this has been working for women. We found out that for every dollar we spend for family planning and sexually transmitted disease and pap smears, we save $4. So I'm going to include that also in a plan when you purchase insurance. Women don't have to pay a copay now under their insurance for their pap smears or mammograms, their birth control. That's in President Obama's Affordable Health Care Act. That's very important because we as women pay a disproportionate share. Because we have body parts sort of like a car. You know, there's part of our the part of our body that nestles the baby, the part of our body that nurses the baby. They need fine tuning sometimes, and he recognizes that and has put that in his legislation. While on the state level, this Department of Health reorg is going to take some of that away. So we have to understand that we're having things taken away from us faster than we can put them back.
The fight is over the money, who pays? You know, if I have insurance, and we're retired military, there's some nice things that go along with those benefits. Some people don't have that, but many of those persons that I talk with, they are paying their own premiums. When you get your Social Security check, there's a certain amount that comes out that goes into Medicare or other things that you need to help keep you healthy. And now everybody's stumbling and bumbling trying to figure out, well, what's in it for me? But wants to take away some of our rights. I call them my body part rights.
Right.
Now, don't tell me what's not good for me. If my money spends, I say, well, where's the dollar? Where is it going? It's like that thing the lady said, well, where's the beef?
And
We've
not
gotta do
just
this.
with the money, Anita, some of it is infringing on our rights, where they want to restrict what it is that we can and cannot do.
Correct.
And that should be a concern for
Well,
everybody.
and I just want you to know that New Hampshire legislator has it figured out. She has said, a woman has said, that if you're a married couple and you can't afford insurance, so you can't afford prescription birth control, then as a married couple, you should remain abstinent till you want a child.
Oh, well, that would solve a whole lot of problems.
So that's your insurance plan. That's her answer, you know, to your health care insurance. If you're married, just don't have sex. Of course, don't have sex when you're not married either. So she has it all figured out.
Well, that might be part of the master plan.
Well, one other thing too, this is a nonpartisan rally because this isn't something that affects you based on your party affiliation. It affects all of us here, all women, and we want men to come out because they love and support us, and it's an impact on them. It affects their mothers, their sisters, their wives, their daughters, and we want everybody out and supporting us because we want the politicians to realize that as women, we hear you, we see you, and we vote.
Well, that's the whole thing. It seems like somebody wants to mess up the voting process.
Absolutely.
That's
And they
it.
keep putting little wedges in places that you can't jump over them, and you can't push them aside because they're right there in front of you.
Exactly.
But thank you for being a thinker. See, because I can't think of all that.
Right.
But that's why we have to team up as women
Exactly.
and fight this war.
Mhm.
And really, it's on us, and I'm so glad that you all have taken the initiative to get this thing moving in the right direction.
Yep.
Who do we invite? Who can come?
Everybody.
Okay, not just the ladies.
Everybody.
I always tell my husband, you can come too,
Yes.
so you
And
might
that's
learn something.
And we'd like to see the young people there, because they're the ones who are really gonna be walking into, a lot of us our age, we have our insurance, or we
Mhm.
have our Medicare right now.
Mhm.
We have it, but they're coming up where they've got nothing. If the Affordable Health Care Act goes away, those college students who are being covered by their parents on their insurance till they're 26, that goes away. So these young people have got to get involved and get this fixed.
I think we can do that. I think it's just a matter of getting the information out there in the right
Exactly.
way, so, because you can throw so much in the pot and it just gets messed up.
Mhm.
But that's when somebody has to come in and starting to divide, not to divide and conquer, but to
Right.
divide so we understand step by step what's going to happen. We're gonna take a break, and then we're gonna come back and deal with some of the activism or the things that we need to be doing in our communities, in our homes,
Okay.
churches, and what have you. So stay tuned. We'll be right back after these messages.